Welcome back to Great Dave. All right, so the old way of treating vein disease was the painful and invasive procedure called vein stripping. If you saw an older relative go through the process and are putting off treatment for yourself, you should know things have changed radically. Dr. Tonie Reincke from Reincke Vein Center shares how the modern way of addressing your veins is quick and comfortable. Good morning.
Good morning.
All right, I was with somebody this weekend, exactly what I just talked about. I said, you need to get that taken care of, want to send her your way. But she said, no, I saw what my mom went through. You saw what people went through as well, up close and personal, but you want to let people know it's not the same way anymore.
No, it's not. It used to be a process where patients had to get general anesthesia, have surgery, and they were, like you said, veins stripped. And then there was a 6-week recovery period that was pretty painful. Now patients are in and out of the office. I do the procedures within probably under 15 minutes myself, and they're back to their normal activities the same day. There's no downtime and no pain medication necessary.
Yeah, you were an RN in a surgical intensive care unit because you would get those patients through in the olden days, but that's what prompted you to extend your education and become a specialist in this field.
Yes, ma'am. Absolutely. So I did see those patients and thought that was kind of, in my opinion, sort of a brutal procedure. And now it's kind of come full circle for me. I'm a physician. I'm a subspecialist interventional radiologist. This is what I trained for and did a fellowship for. So yeah, it's nice to see it's much different now.
Yeah, and this is one of those things we were talking about aging a little bit earlier. It's just one of those things that naturally comes with some people for aging, although it's not normal for this to happen. But vein disease, about 27% of adults?
Yes, that's correct. So probably I would say like 1 in maybe 3 or 4 people actually have vein disease. Just because you have it, though, it's important to understand it doesn't mean you have to be treated. But if you have symptoms like tired, heavy, achy, swollen legs, skin discoloration, those kinds of things, and they're interfering with your daily activities, that's going to be something that prompts you to come in and possibly get treated.
Yeah. It's like tired, heavy legs. We call it like the Herman Munster situation, right? And so many people, what they end up doing is they just compensate and chalk it up to, well, I'm just aging. There is an answer for this. We talked about that new procedure, but take us through what catheter-based, like exactly what you do.
Okay, so patient comes in, we're going to clean off their leg, give them local numbing, a little bit deeper numbing under ultrasound guidance. So it's real-time imaging. I'm going to make a tiny little cut, put a catheter in their leg, which is kind of like a flexible straw. It has a coil element on it. And what I'm going to do is take that stretched out vein. I'm going to heat it and seal it shut. The catheter then comes out of their leg and their vein stays in. Over time, that could be a period of months, that vein is just going to turn into scar tissue. And then enzymes, which are like little Pac-Men in your body, are just going to dissolve that vein over time.
All right, I'm going to ask you a question that might sound silly to some, but I'm sure people ask you, what? You're going to collapse the vein. Don't I need that vein?
No, not if it's not working. That's why surgeons used to rip them out of your leg. So if it's not working, what I do is when I close the vein, I'm going to reroute blood, and you have hundreds of other veins that then drain into a deeper vein and take it right back to your heart.
Yeah, and Dr. Reincke, I know a lot of people who it sounds like from the education I've gotten from you, it sounds like they may have vein disease, but what they're doing is going to other doctors, like if they have that kind of, purplish, scaly, itchy part of the leg, they're going to a dermatologist, right? Or they think it's something that's muscular that's wrong. And so they get misdiagnosed or mistreated. That's why it's important to come in and get an evaluation.
Yes. I mean, if they have any of the symptoms or signs that you just described, just understanding, that's why I'm here, is to educate, understanding that it's not a normal part of aging, and that, you can come in. There's no cost to you. It's a free consultation. Come in, see me, and I can go over education and discuss, potential options for you, because it may not just be a skin issue or, like you said, musculoskeletal issue. There may be something else going on.
Yeah, and the evaluation itself, I've had it done, is so simple and quick.
Yes, yeah. Literally, probably it takes me 5 minutes.
Yeah.
In terms of the free consultation, then I can decide based on your history, physical exam, whether or not that warrants an ultrasound. And if it does, we do the ultrasound here in the office. I have an ultrasound vascular tech who that's his area of expertise. We do this all day, every day.
Yeah, and that's non-invasive, so no discomfort at all associated with that. And then, of course, the other thing that keeps a lot of people from taking action is cost. This is something that, Medicare and Medicaid recognize.
That's correct. So most commercial insurance, including, like you said, Medicare, Medicaid, cover the cost of the procedure minus any copay or co-insurance that the patient might need to spend.
All right. One of the things that you also, you love what you do so much. At times, if somebody might need a different time other than normal office hours, you can make arrangements. You give people your phone number. You want to make sure that you said education is at the forefront for you as well. Also, your community involvement. You do free screening events oftentimes throughout the year.
Yes, several this year already, but that was a Hispanic health outreach that we did with Baker Ripley. This particular image is the African American Men's Wellness Association and a Women's Health Wellness Day. And then we have one coming up March 1st with Miracles Are Real, where we will be doing community outreach downtown.
Yeah, the March for Health community event, March 1st, 11 a.m. to 3 p.m. Dr. Reincke, thank you very much for joining us this morning, and thanks for getting people up and moving again.
Yes, ma'am. Thank you for having me.
All right. Reincke Vein Center has a special offer. Mention Great Day Houston to receive a free consultation. Call them at this number. It's 281-394-4446. Again, 281-394-4446, or visit their website at reinkeveincenter.com.